Hello, everyone, and welcome to this episode of The Healthy Department. Today, we're going to talk about Smiles That Matter, student dental care in Greenup County Schools and the Russell Independent School District. Our Greenup County Health Department dental team is here with us today. We have Kaylee, our dental hygienist.
Hello.
And Caitlin, our dental hygienist assistant.
Hi.
So today, they're going to tell us a little bit about what they're doing in the schools and why dental care is important.
Greenup County Health Department. Our legacy of health lives on. Greenup County Health Department. Public health is public wealth.
As we get started today, just introduce yourselves. Tell the listeners, what you guys are doing.
So basically what we're doing is, we have the dental hygiene program here at the Greenup County Health Department. Like you said, we go to different schools. We go to schools in the Greenup County school system. We go to the schools in the Russell school system. We also see kids at the Northeast Head Start and Flatwoods. We're seeing homeschool kids at the Greenup Public Library. And we do all kinds of events and just help the community.
Awesome. So you guys are definitely out and about on pretty much a daily basis. And if you guys haven't seen them, they're in a bright hot pink van covered in teeth. I believe you all have a name for her.
That's Ruth Ann the Tooth Van.
So you guys can see them driving around Greenup County. So can you guys tell us a little bit about why school-based dental care matters in rural health communities?
Yeah, I think that it's really important because, there's not a lot of access to care here in this area. It's really hard for families to find, dental providers for their kids, especially, with certain insurances, like Medicaid. So we're just here, to help those families that need it. And, even if you do have a primary, dental care provider that you normally see, we can still see your kids. We can still, provide them with an extra cleaning and some oral hygiene instruction, too, if they just need a little extra help. So we're just here to help the community in any way that we can.
Yeah, that's awesome. So you guys aren't charging through dental insurance?
So, yeah, we don't bill dental insurance. It's free to everyone that would like to be involved in the program. We don't do any kind of sort of dental billing at all.
Okay, so if people are interested and you're telling me that there's no guidelines, you can see all the students in the schools that you're contracted with and even at the library, the homeschooling program. So how do people get signed up to be seen by you guys?
So we send the consent forms to the school. The nurse or the teachers will send them home with the students. Then the students will give them to their parents. Parents will fill them back out, send them back to the school, and then we will either pick them up from the school, and then we'll just go from there.
Okay. So now say, because, I know myself as a child, I was never good at getting my parents, the forms that my teachers would send home. So how can parents with the kids that are attending the schools that you're seeing, how can they get that form just online or at home? Can they do that?
Yeah, so we actually have a link to it directly on our website, the Greenup County Health Department website. We also post on Facebook, the link to that form as well. If you're ever interested and, you haven't seen it from your school, you can always contact us here at the health department and we can provide you with that information.
Okay, nice. So while people are kind of thinking, should I be seen? Should I not be seen? Can you kind of make the connection between why is oral health important even, for our overall health?
Oral health and overall health is connected because, sometimes if you have some infection in your teeth, they can go straight to the bloodstream and go to your heart, your brain. It's a lot more involved than people really realize, especially with things like diabetes or, hypertension, stuff like that. Smoking can really affect, your teeth and your overall health as well. There's just many things that, is correlated to your teeth.
Yeah. So, Kaylee, why did you choose going into public health dentistry?
So I chose to go the public health route because I have been in general dentistry for about 4 or 5 years, in a normal practice. And I wanted to, help the community better. And where I live here in Greenup, and I just want to give back to the community and help those kids in need and anyone else that needs dental advice or anything like that.
Yeah, that's awesome. So have you been enjoying your time in the public health field and seeing kids in the schools?
Oh, absolutely. I love it. I know Caitlin loves it too. It's just a really good time seeing the kids and, being connected with everybody.
Yeah, so can you kind of describe, what does your all's typical day look like when you're doing these school or library homeschooling visits?
So we'll pack everything up. We'll go to the schools, set up all of our stuff. Then we just start calling the kids down one by one. We really get to connect with the kids. Some of these kids have never been to the dentist, so they don't know what's going on. So we really just try to have a fun environment for them. Nothing scary. We don't do any pokies. We tell them. We just sit there and talk to them, clean their teeth. And then,
okay. So you guys aren't only seeing young kids, too. You guys are seeing high school as well?
yes, we see pre-K through 12.
Okay, nice. So when you are seeing these kids, what kind of services are you doing when a kid comes to you for an assessment?
So basically what we do is, we'll first do an assessment, see if they have anything going on, any obvious cavities. Then we'll do, the cleaning, and then we'll do a fluoride varnish. And then we can do sealant placements on, those adult teeth, just to prevent, a lot of prevention is what we do. We don't do any restorative work, but we do send home, anything that we see to the parents, and a list of dental providers in the area to try to get them into a dental home. I think that's very important. That's one of our main goals, is to get these kids into seeing a dentist regularly.
Well, that's awesome. I think it's great that you guys are getting in there and providing that, first level of care, and then getting kids referred who may need, that extra restorative work or some sort of more invasive procedures by a dentist. So how do you think the importance of access to care is for these families for this dental program?
Oh, it's very important. I think that everyone deserves, access to care, especially for dental. It's very important, especially these kids, when they're going to school, they're more focused on maybe their teeth hurting or, the appearance of their teeth. I think it's important that they do see a dental provider and have that, security and having some place to get their teeth fixed. And so they don't have to worry about that, and they can focus on school and, being a kid.
Yeah, that's important because sometimes, especially if a kid might be having pain, they don't see a dentist regularly, and that can affect food intake, and then that affects, schoolwork. Dental problems can be a risk factor for other problems as well. Do you agree?
Oh, absolutely. Yeah. The first, port of health is your mouth, essentially. So the first signs of anything going on would be in your mouth. So, getting that taken care of is very important.
Yeah, that's awesome that you guys are out doing great things in the community and helping, in that first line of defense there. Tell me a little bit about a story that you've had where you've seen a lot of success with a student. Have you, helped them with, have you found something that's going on?
Well, yeah, I feel like we see a lot of kids that's never been to the dentist before, a lot. Kind of help them get over those fears. Kids, sometimes you take baby steps with them. And that really makes you, just appreciate, what you're doing, and that it is worth it, because you see that you're helping these kids, live a healthier life. So I think that's mainly the biggest thing.
And because you see the kids more than once, you go back twice in the year?
Yeah, we try to go back at once every 6 months
Okay.
for those kids. But I mean, obviously, in the summer it kind of changes a little bit. But
So when you have gone back, have there been any stories where you've seen some kids really change their oral health routine or, pay attention more to how they're taking care of their teeth and their mouth?
I can tell that they're very excited about it. I mean, at first, they were hesitant, but then they see us and they're super excited. They'll wave, give us hugs. So it's really a good feeling to know that you're changing someone's life like that.
Yeah, that is awesome that you guys are just in the school and building those relationships with those kids. It's really great work you all are doing. So a little bit for our listeners, is there any tips that you have, whether for, brushing, flossing, give us some good dental tips.
Well, I'd say the main thing is, flossing. A lot of people, put that on the back burner.
Yeah, I'm kind of guilty of that myself some days.
Yeah. No, but I mean, flossing really, you can't reach in between your teeth just brushing. A lot of people don't realize that. Flossing gets all that, the bacteria and food that's in between your teeth that can cause cavities in between your teeth, and you can't always see them. So, I mean, that would be my biggest thing. You flossing at least once a day.
Okay, and the question is, waxed or unwaxed?
Well, I'd say it's just, personal preference.
Okay.
Yeah. I mean, there's benefits to both. Both of them are fine.
Okay. And also, because I know you were telling me once too, because you also helped me with my own routine, making sure I've got that down pat. You talked a little bit about making sure to not use the same part of the floss or...
Right. So there is a technique to flossing. So basically what you want to do is you want to take a string about like an arm length and you want to wrap it around one of your fingers and use the other finger to like kind of wrap around the dirty part of the floss. And, you just move a clean piece of floss in between each tooth so you're not transferring that bacteria.
Okay. Now, what do you recommend for those who use like the picks, the little...
The picks are a good alternative, I will say, especially if people that have motor issues that can't really use the floss as well. I would just recommend, rinsing that floss off before you go to the next tooth so you're not transferring the bacteria like I said before.
Okay, yeah, that makes sense. Okay. So, and then what about when picking out your toothpaste? Like, what's something you kind of want to look for? Is there anything, you should be checking for when you're choosing your toothpaste?
It's ideal to look for that ADA seal, which is the American Dental Association seal. That just says, it's tested and proven to work. I'm going to always recommend using fluoride just to prevent, cavities and help strengthen the enamel. But like say you have some gum issues, you have, you want to whiten, there's different options for all of that. It's just, in your whatever your forte is really.
Okay. Yeah, because I know that a lot of children's toothpaste, they don't have fluoride, and that's just because of the swallowing.
Yeah, right. As long as you use just like a smear on the toothbrush, it's going to be fine. I wouldn't recommend swallowing at a very young age, but I mean, when they learn to spit, I would prefer, the fluoride.
Okay, yeah, that makes sense. And then what about choosing a mouthwash? Do you recommend using that? Is it really just preference? What about that?
I would say, it would be a good additive to your dental routine. It's not a have to. Using, like I said before, fluoride mouth rinse is going to help prevent cavities and strengthen your teeth. But I mean, as far as a have to, it's not really like a have to.
Okay. Now, sometimes there's a little bit of debate out there, I've heard. Now, how many times a day should you be brushing your teeth routinely?
Twice a day.
Twice a day. Okay. Some people do 3.
No
some people
negotiations,
do 1.
at least twice.
Yeah, I agree there. Morning and night, right?
Morning and night, 2 minutes. Set those timers.
So we've got some good tips going there. Are there any common myths or misconceptions about dental health that you hear?
Yeah, that, there's not a problem unless something's hurting. That is not true. There's so many things that could be going on that you don't really know about unless you see your dentist or dental hygienist every 6 months. Like, some people with diabetes, they can easily develop periodontal disease, which is bone loss of the teeth, the surrounding bone of the tooth. There's gingivitis, which is the inflammation of your gums, which means, especially like in adolescent kids, like high school age, they will have that issue like with hormones and stuff like that. So making sure that they get those teeth cleaned and getting the plaque, removed, that's very important.
Okay, and then what about pregnancy too? Because, being my age, I'm in my late 20s, I have a lot of friends who are pregnant, and a lot of them say, when they're pregnant, something is going on with their teeth, they lose teeth. Is that, can you tell me a little bit about that?
So basically, hormones play a huge factor in like your gums and like your plaque levels and all that stuff like that. So yeah, brushing is very important in pregnancy, and you have some food aversions, maybe you're throwing up some, that's all factors in, oral health when you're pregnant. I would just see your dentist and, have any recommendations for your personalized care in those situations, because everyone's different.
Yeah, so definitely, everyone should really be seeing their dentist. How often should you be seeing a dentist?
At least every 6 months.
Okay.
Yeah. Now, if you have bone loss, it could be more times, every 3 months, every 4 months, just depending on what your provider says.
Yeah, and making sure to complete those follow-ups.
Yeah, that's very important.
Yeah, okay. So, Caitlin, as you've started in your dental hygienist assistant position, is there anything recently that you've learned? I know you haven't really been, you're kind of new to the program.
Mm-hmm.
So tell me a little bit about that.
I came from a hospital setting, so it's completely different. Getting to work with Kaylee, getting to learn all the
Ins and outs
of dental. It's definitely new. I really enjoy it. Getting to work with the kids, just getting to help the kids is really rewarding. Just like you said, she was helping you with your dental routine. She started me on a new dental routine. Yeah. I was very bad about flossing. Very bad about it. Now I actually do take care of myself a little bit.
Yeah, I was in the same boat, just a little bit.
I need to floss.
Yeah, so that's awesome. You guys are getting in the schools and really just learning to, grow these connections with the kids, teach them about the importance of dental health. Really that's kind of one of the first lines of defense when it comes to our overall health. So how can families learn more about you guys, your program? How can they get in contact with you?
So you can call the health department and ask for Kaylee or Caitlin. And we are happy to answer any questions you have, if it's related to our program or just, some tips in general or any questions really. Also on our website, on the Greenup County Health Department website, we do have a tab there that says a little bit more about our program and a link to that direct consent form. As well as Facebook, we're always making reels. We're always, making posts and all that stuff. So yeah.
And you're on the app too, right? We have a Greenup County Health Department
absolutely,
app.
Absolutely, the app has updates on there as well, just for everything in the community, really.
Okay. And then what about maybe someone from some schools that don't have you guys coming in yet in Greenup County? How can some schools reach out? Is that still possible?
Yeah, we're still, looking to serve schools in the Greenup County area. We're always open to it. So, if they just reach out and say, hey, this is what we want to do, or, they want to set up a meeting, we're very open to that.
Yeah, so that's great. You guys are so open to the communication from the community and from different schools. So hopefully the lines will be ringing off the hook soon. And just to make sure, it doesn't charge the dental insurance.
No, so we do not charge dental insurance. but it is provided through Medicaid medical provisions set aside for the health department, but it does not interfere with your dental insurance. So if you still see, a dentist regularly, it's not going to interfere with that.
Okay. And that's even for those with private insurance or
Right.
stuff like that?
We do not bill any type of private insurance, just, straight Medicaid medical for the health department. That is the only thing that we bill. We do not bill any type of dental insurance.
Okay. Well, that's awesome. This is a great program available for families, people in our Greenup County community. I really appreciate you guys coming here today and just kind of shedding more light on what you guys are doing. Driving around in Ruth Ann the Tooth Van isn't all just for looks. You guys are really hard at work in our county, and we do really appreciate all the hard work that you all do. So until next time, I really appreciate you guys coming to chat with us on the Healthy Department.
Thank you
Thank
for
you.
having us.
And thank you all for listening today. For those who are listening, please make sure to like and subscribe to wherever you're listening to our podcast from. Also, if you're interested in any of the services that we offer here at Greenup County Health Department, you can visit our website, greenupchdky.gov, or we also have an app available for Apple and Android users, and that is just the Greenup County Health Department app. Please feel free to reach out if you guys have any questions or concerns. Until next time, thank you.
Bye.
Bye.
Greenup County Health Department. Public health is public wealth.